Hello YouTube, this is me again. I'm just trying to give you guys, hopefully it's a quick update of my procedure um, with Dr. Luis Nader in Reynosa, Mexico. So for my procedure, he said he was going to do it over the course of 2 days. So I just finished day one. So for day one, he said the whole procedure for me was going to be pretty much maximum of 27 to 2800 grafts. It might be a little bit less, but the max was going to be 2800. So for today, he did 1400 grafts. If you saw my previous video, then that gives you a very good idea of what I look like before the procedure. So for today, he did 1400 grafts. I really wanted a lot of density, so he pretty much did all of this up to here. He moved in a little bit. Like, he does a good job, so he reinforces the surrounding areas, just in case you lose more hair in the future. So 1400 grafts today, a little bit above 1400. I'm not sure of the exact number, but tomorrow is probably going to be another, I'm getting 1300 grafts. He said it might be less because the 1400 grafts that he had extracted today, it covered a lot of area. So if less grafts gets the job done, then I'll be excited because it's going to be more money in my pocket. Like I said, I'm a student, I'm a med student, so by the time I'm done with med school, shoot, I'll be owing a lot of money. So yeah, any extra change, not just for my situation, but for anybody out there, except if you're balling like that, any extra money in your pocket, it's a blessing. So just want to show you, give you a closer look, hopefully. So yeah, sorry for the blood up here. It's probably, I don't know. So this is what 1400 grafts get you. Just keep in mind, I know I'm not showing my face, but I have a pretty big head. Not that big, but pretty big. I wear why I'm saying that, because if you have a smaller head, then obviously you probably wouldn't need as much grafts as me. For the new era baseball hats, I wear 7.58. So that should give you like a good idea of the size of my head. So that's 1400 grafts. So the procedure is fairly easy, You have to be patient, to be honest. I actually like the fact that I'm doing it over 2 days, because that way he can take his time. He said the maximum he has done in 1 day is like 3,000 grafts, but he said, he's gonna do mine, because I scheduled it a while ago, so he was gonna do mine over the course of 2 days. So yep. So just to give you guys a good idea of how my day was like today. So Santos, the driver, he came to the Holiday Inn, which I'm staying in. So he called my cell phone, and I just went downstairs, and it takes like 25 to 30 minutes, to get from Reynosa to get from McAllen, Texas to Reynosa. So when you go up there, when you're going past the border, they don't ask you any questions. Santos just pays the toll fee, and that's it. He goes through. For those of you concerned about safety, It's not an issue, to be honest. It's really not. Like, especially, it's not. Yeah, it's Mexico. It looks fairly different. Like the Reynosas, the places I pass, it looks fairly different from United States, but not really. Because I've driven past some hoods, if that's what you want to call it, and some of them look much, much worse. And also, I'm from Africa, so I've seen, worse areas. So if you're concerned about safety, honestly, for me, it's not a problem. In life, there are no guarantees, but for me, if that's one of your concerns, then it shouldn't be a problem. You just drive past the border, he pays the toll, and then by the time you're past the border, it takes less than 10 minutes to get to Dr. Nader's office. His office is on the top floor. There are 2 floors, and it's gated. Like, nobody can just walk into his office. Like, they have to buzz you in from the gate, the main gate that takes you up the stairs. So once you get in the office, it's pretty much the setup is just like, if you've been to like, some clinics up here, it pretty much looks the same. It's very clean. He does a good job maintaining that place. It's very clean, very professional. The TV stations, for the most part, except if you request it, you can change it, but most of it was pretty much in English. They have American channels, whatever you want to watch. So I went up there, got there like 8 something, talked to Dr. Nader for like an hour and a half. Really nice guy. I can't stress it enough. He's very experienced. He's been doing this for at least 14 years, I believe. So he has experience. He has done Caucasian hair, blacks, Indians, Asians. So at least he's been around. So he's done the work. He just told me he did an African American, I think, last week. So he has a good amount of experience, with all types of hair, in my opinion. So, and from what he tells me, he's not paying me to make this video, but I just want to put it out there because if not for YouTube, to be honest, I would not be going to Reynosa, Mexico. If not for Tom Forrester and Evan Anthony, there was no way I was going to go up there. So I'm just making this video just for those people out there who are really like iffy about doing the procedure and probably going to Mexico and concerned about your safety. For me, it's no big deal. I'm in the Holiday Inn in McAllen. If you want, you can stay in the Holiday Inn in Reynosa, but I wasn't trying to do that, so I just rather stay here and then travel over for the procedure. So this is what it is. You can stop the video here. That's all I want to say for now. But for those who want to hear more about, how my procedure went, you can keep watching. Like I said, I talked to him for an hour and a half, and then he gave me this they're kind of like disposable scrubs, I guess. I don't know what you call them. I've never, in the hospital, disposable scrubs. This is the hat that I'm supposed to sleep in, but I kind of took it off because I'm really nosy, so I just really wanted to see what it looked like. I wasn't supposed to take it off tonight until tomorrow, but I'm just gonna be careful. So yeah, as I was saying, I talked to him for an hour and a half. Then he took me to another room where he has like 5 or 6 assistants who help him with it. The first room I went to, it has like a massage table, so you just lay on your stomach, and then they extract the hairs from the donor area. So and one of the ladies helped him out with that process. So that took about 3 to 4 hours. Typically, he said it takes about 2 to 3 hours, I guess, but it kind of took, I guess, a little bit longer for me. I don't know why. I fell asleep like a few times. It was actually almost starting to snore. I had to catch myself. So I know he wouldn't make a big deal out of it, but I just don't like the idea of snoring in front of people like that. So after that part, you know, he moved me to another room, which is where I was going to do the procedure, but he gave me lunch. So I had the chicken salad and some orange juice. So he gave me that, and after lunch for about 20-30 minutes, then he started putting in their hair follicles back in. So that took about, I would say, like 2.5, maybe 3 hours. So it wasn't really painful. You know, I really don't have swelling, which I'm kind of happy about. So I have to keep this bandage or headband, whatever you want to call it. I have to leave it on for at least, you know, 24 hours. So he's going to take it off tomorrow because he has to do my temples tomorrow and the rest of it. So at the end of the day, I'll post another update tomorrow, so I'm not gonna try. I already talked a lot. I'm not gonna try to talk too much, but 2,800 hairs, 2,800 grafts maximum. So you're looking at roughly, for me, I chose the up to $3,000. I mean, up to 3,000 grafts. So if you do that plan, then you're looking at $5,500 and some change. But if you do the cash discount, then he takes off 10%. So you're looking at $5,000 for 3,000 grafts. Then if you're planning on doing 2,000 grafts, then you're looking at $4,500, and then with the discount, you're looking at maybe just, you do the math, maybe just a little bit above $4,000. So that 10% does a whole lot, you know. That could be your plane ticket or money for gas, you know, for the trip. So it's really helpful. So yeah, so that's it, guys. I'm gonna talk more tomorrow and keep you guys updated. All right, peace out.